should do, they're listening now and they say, okay, listen, I need to look at my oral health. Then we'll do a bit of a home care, what they need to do. I was introduced by Dr. Brownstein. I met him in terms of IV hydrogen peroxide. I started using a water pick with hydrogen peroxide. I don't do flossing with hard flossing anymore. It's been great for my gums. My gums are in better health. But take us through the sort of process, someone's listening now, of diagnosis, how cavitations work. Some of my patients have been scared about IV antibiotics if they get an infection with the cavitation, but just take us along your journey.
Okay, the first question, just to summarize everything, is for you guys out there. Ask yourself 3 questions. Have you ever had any metal in your mouth? Ever had a root canal? Or your wisdom teeth removed? If any of the answers is a yes, you definitely need to see a biological dentist in the future. But obviously we can start optimizing upfront. So the journey, if you want to see us, for example, or any trained specialist, is that we need a current panoramic x-ray, not a 3D. We don't need a cone beam right now. We just see the panoramic one to just diagnose it, and then we will plan your case preliminary. And then obviously before you come see us, we will start optimizing your nutrition and your lifestyle, because I don't want to have you in our clinic in hibernation mode, which most patients out there are, unfortunately. I want you to be as boosted as possible when it comes to macros and micronutrients. So you come in fully prepared, and then the journey when you're here in the clinic, let's say the health starts in your mouth journey, is obviously that we will do blood work, we will do a full clinical examination, we will then take a 3-dimensional x-ray, a cone beam when you're here, to fully diagnose everything. We will also do an ultrasound scan to see further lesions, and then we will just do whatever we need dental wise. Obviously remove the metals safely, which is a 7-fold measurement. Then we will do the surgery, which is as minimal invasive as possible. We use piezo surgery locally, and ozone. We will draw blood and spin it to make PRP membranes that we later use in your mouth. So we basically do everything that's high-tech. We remove obviously all the root canals, that's my specialty, and place ceramic immediate implants, no metals, no titanium, and then you will have some temporaries. To make this whole concept even more round, you will receive a ton of different IV nutrients. We even put laser into your veins, LLLT, low-level laser therapy, which basically enhances or turbocharges your nutrients and your healing. We also have a hyperbaric oxygen chamber in the clinic. We have an infrared sauna. We use every modality from biohacking that you can imagine, even microcurrent frequencies. In the future, we also have an acupuncturist coming in and an osteopath during that week, and make sure that you learn as much as possible about your health journey and give you all the tools. You will also be prepared with an onboarding online course that I've designed so that you know everything. And when we meet in person, we can really go deep, and I will make you to become the architect of your health by starting in the mouth. And whatever symptom you imagine right now, unless it's not optimal health, there is a strong correlation to overall health and oral health. Whatever it is, we talked about pregnancy, not getting pregnant. It can also be menopause and oral health, testosterone optimization and oral health, estrogen and oral health, skin health and oral health. There is always a combination. And this is what we finally need to understand, that the mouth is a big part of your body. It's the entrance. Whatever you do in there or on your teeth is working systemically and can do the whole issues that could start from the mouth or can be from an outside. It's just an epigenetic stressor, but it's installed in your mouth 24/7, and you cannot biohack your way around it. You can just compensate it by doing as much optimal health strategies that you can and you should. But this is one final part that is missing.